Okay, so let's talk about synovial joints. So practice drawing a synovial joint. All you need to do is draw a bone, draw another bone, and then put a water balloon between the two of them. And then we're just going to be labeling some stuff, but make it simple. Okay, you don't have to be an artist in order to be able to draw a synovial joint. Let's start with required components. The first required component is the synovial cavity. It's that water balloon that you put between the two bones. Only learn the terminology. It's a synovial joint. It's called a synovial cavity. And guess what? It's not full of water. It's full of synovial fluid. Yes, the synovial fluid is a very watery environment, but in reality, it's not watery. It's more akin to egg white. Okay, so it's got some viscousness to it. And it's really thick in the morning when you first wake up because your joints haven't been working while you've been lying in bed sleeping. And then as you start working your joints, you start secreting more watery fluid into it, and so it thins out. So, like if you have parents who have arthritis, you may hear them talk about, wait, like we can't go to the store first thing in the morning. I have to get my joints have to start working. And that's what they're talking about. The fluid has to thin out a little bit. Okay. So, first required component, synovial cavity. Second required component, synovial fluid. Now, somehow we have to connect these two bones, okay? But also don't forget, on the ends of each bone, outside this cavity, we still have to have that hyaline cartilage. So you can see that that hyaline cartilage is represented in blue. And so part of that water balloon wall is actually the hyaline cartilage in blue. But part of that water balloon wall is not hyaline cartilage, okay? So it's not going to be hyaline cartilage except where it is on the actual bone, okay? So the rest of the connection is going to be through a joint capsule. And the joint capsule is actually made of two different things. The side wall first has this thin layer, which is this green part, and this is the epithelial layer, which is a synovial membrane. Who would have thought we would have called it synovial membrane in a synovial cavity? Duh. This is what's secreting the synovial fluid. And then it's going to be surrounded by dense connective tissue. And because we're talking in 3D, it's going to be dense irregular because we don't just want it one directional. We want it this way and that way and this way. So it's dense irregular connective tissue. So those two layers together, what is green here and what is this tan here, forms the joint capsule. Oh, and did you notice that this dense irregular connective tissue is actually contiguous with the periosteum, which was also dense irregular connective tissue? So those exact same fibroblasts just are continuing all the way down from one bone to the next bone as one solid layer of connective tissue, lots of collagen trying to connect the two bones. All right. But as you can imagine, that's not a whole lot of strength. Okay, because we got this floppy water balloon thing in here. And so those bones are kind of like flopping around. So we got to try to give them some oomph to hold them together. And so we are going to throw in some ligaments. So we can have ligaments here on the outside, dense regular connective tissue to give strength in this direction only. And in addition to ligaments outside the joint capsule, We can also have ligaments inside the joint capsule, like for instance, inside your knee, your anterior cruciate ligament, your posterior cruciate ligaments. Those are here inside. Okay. So we can have ligaments inside and outside the joint capsule. So those are the required elements for all synovial joints, okay? Having the synovial, go through them real quick once again. Having the capsule, having the fluid, having the cartilage, having the joint capsule, and having the ligaments. Those are all required. Now we have some options, and we're going to talk about two options. So for this, I'm going to take you to a specific joint. This is a knee joint because you can see the femur coming down to the tibia. You can tell it's a knee because we've got a lovely little patella sitting here. So this is the quadriceps tendon coming down to patella, and then we have patellar ligament coming down to the tibial tuberosity. You can see a little wedge-shaped piece here. We've got two little meniscus trying to keep the tibia from sliding off the flatness of the tibia. And then we've got these little blue things here. Have you ever heard of anybody having bursitis? Well, that bursitis is inflammation of bursa. So we're going to talk about two options here. We're going to talk about a meniscus and a bursa. So the first option is a fibrocartilaginous disc. In the knee only, we call it a meniscus, but the real term is a fibrocartilaginous disc. We have them in other places, such as in our temporomandibular joints. Okay. And the whole point of these is they improve the fit between these two bones to decrease the wear and tear on the bones. And they allow different movements in different parts of the joints. So remember, this is an option like air conditioning, sunroof, not a requirement for all synovial joints, found in a distinct minority of synovial joints. Another option is a bursa. A bursa only occurs where ligaments, muscles, skin, tendons, and or bones may be rubbing together. And basically, they're like little flat fibrous sacs filled with synovial fluid. And so you can have them between bone and the skin. You can have them between bone and a ligament. You can have them between ligament and the skin. And so basically, they're going to cut down on friction in these things. And if you have a lot of repetitive movements, such as if you're down on your hands and your knees in this place, scrubbing the floor, you're going to get what we call handmaid's bursitis from scrubbing the floor. Or if you're playing a lot of tennis and you're not used to playing tennis, you're going to get bursitis in your elbow. Once again, this is an option. So there are 6 different types of synovial joints. I'm going to talk about 2 types that you already know from grade school. The first is a hinge joint. This is like the simplest type. Basically, you have a trough and then a cylinder fits into it. This is like how doors work or piano benches work. And this is how the U-shaped divot at the proximal epiphysis of your ulna fits one of the knuckles of the distal epiphysis of your humerus fits in there. And so your elbow is a hinge joint between the humerus and the ulna only, not between the humerus and the radius. That's a different type of joint. Okay. Another example of a synovial joint is a ball and socket. And this we have in the shoulder only between the humerus and the scapula right here. This is a very shallow ball and socket, as we talked about before. So it's prone to dislocation, and that's why we have the 4 rotator cuff muscles. We also have a very deep ball and socket between the head of the femur and our hip. Because it's so deep, we don't have nearly the range of motion in our hip that we do in our shoulder, but it also means that our hip is less likely to be dislocated. unless you put your feet up on the dash of the car and get in a car accident, in which case you're asking for a hip dislocation. Now, just a couple of slides on very common movements in synovial joints. The first two movements have to do with changing the angle of the joint. If we are decreasing the angle of the joint, such as decreasing this angle of my elbow, that would be flexion of the elbow. If we increase the angle of the elbow, that would be flexion of the elbow. This is not arm flexion. This is forearm flexion. Okay, so instead of talking about body parts, arm and forearm, because what we are moving here is the forearm. So think elbow flexion, elbow extension. Arm flexion has to do with moving your shoulder. Okay. Now notice that in elbow flexion, we are moving this direction, which is the opposite direction that we are moving in knee flexion, where the foot is going backwards. Okay, so it has nothing to do with moving forwards or backwards, because in arm flexion, our arm is moving forward. In elbow flexion, our forearm is moving backwards. So it has nothing to do with moving forwards or backwards. It has to do with inflection. We're decreasing the angle at that joint. So talk the joint. Joint flexion, joint extension, elbow extension. The second type of motion has to do like when you're doing jumping jack. You are moving away from the midline of the body. If we are moving away from the midline at the shoulder, that is abduction. So think like somebody is abducting a child, stealing a child away from the midline. If you're going back towards the midline, you are adding things. So you are adducting. This also happens with your fingers. If you're going away from the midline, spreading your fingers, that would be AB, abduction. If you're putting your fingers together, that would be adduction. Okay, that's it for synovial joints. Come back for this third section where we're going to talk about 3 common types of arthritis.